I'm Dr. Kristina, chiropractor and co-owner at Miss Tutman Chiropractic, and today we're going to talk about headaches. So there are lots of different causes of headaches. Obviously, as a chiropractor, one of the things that we deal with a lot are headaches and migraines. Headaches and migraines do differ, and there are some main reasons why they are classified and diagnosed differently. However, sometimes the cause is the same. So for today, we're just going to use the term headaches, and do know that if you are a migraine sufferer, or you know someone who's a migraine sufferer, this information may still apply to you. So obviously we have our head on our neck, right? So basically this is a bowling ball. 10 to 12 pounds is the average head weight on a pencil, all right? So if we're looking at this, what this is here on the spine, this is just the very bottom portion of our skull. So we've got our whole head on top of that. Obviously includes our brain, includes our hair, everything else that is in our head. What can happen, and what happens to a lot of us, is we no longer have this nice curve that we're supposed to have. So these curves in our spine, we've got 3 of them. We have our neck curve. So if we're looking at this in the same direction I am, curves forward. Our mid-back curves backwards, and then our low back curves forward. The reason for that is shock absorption. If you think of a spring, it's coiled, it's curved. That has shock absorption. If you were to uncoil a spring, no more shock absorption. Same thing happens in our spine. So unfortunately for a lot of us, looking down on our devices, sitting on our computers, most people don't have great posture. And what happens with that is it removes or even reverses the curves in our spine. And what happens then, every single step we take, we start compounding in our spine, whether it's in our neck, mid-back, or low back, and then we don't have that shock absorption anymore. How does that affect your neck? Well, in addition to that we just talked about, not having that shock absorption, when your head is more forward, what happens is our ears get in front of our shoulders. We tend to have more of this C-shaped curve, and that will turn on all of the muscles that are connected to the base of our skull. So a lot of times people will say, oh, it just feels so good if I press right here, my headache goes away. A lot of times that has to do with posture, and it has to do with that muscle connection. If you can see here, all of these red dots here are all separate muscle connections. Every single muscle problem is also a bone problem, because every muscle has to be connected to 2 bones. So it's not just one bone problem with a muscle problem, it's 2 bone problems. What happens often is these top 2 vertebrae, I like to refer to these as the headache bones a lot of times with my patients, or the sleep bones. So if you're also having problems sleeping, this may be part of the problem. These are very important. That is right where your spinal cord starts. And if these are out of alignment, some of those nerves actually wrap back up into your head. So that can cause pain. It can also cause problems with the rotation and how much your head moves. If you're trying to always turn to look to your left, to look out the window while you're driving, and that rotation is stuck, that's going to further irritate that problem, causing more headaches. There's lots of other issues, but as a chiropractor, those are the ones that we most closely deal with on a daily basis. If you've got headaches or migraines, there's a lot more information, but these are kind of the basics. So chiropractic can help a lot of people with migraines or headaches. Give us a call today to see if we can help you.